This is Selma Schimmel for the group room at the Community Oncology Alliance COA meeting in Las Vegas, joined now by Dr. Rick Frame, medical oncologist at Utah Cancer Specialists, and you are the chair of COA's Patient Advocate Network.
Yes, ma'am.
Very compelling because we were talking with some of your colleagues earlier, this great paradigm shift where once upon a time patients had a much more passive role in relationship to their physicians, and now patients have a very proactive role and a vital voice that oncologists need.
Absolutely, and that's what we're trying to foster and promote at CPAN, the COA Patient Advocacy Network. We're a group of doctors and administrators and patients who are trying to make a difference. And you're absolutely right that in years past, patients did have a very inactive role, but we have engaged them in such a way that we hope to continue their participation and make COA great through our patient advocacy.
When was the Advocacy Network established?
2003, and it's taken us several years to find our way and to create the infrastructure that's necessary.
What's the goal of the Patient Advocate Network?
The goal of the Patient Advocacy Network is to enact legislation favorable to cancer patients. It is to prevent the numerous threats that are occurring to community oncology. The closing of cancer clinics, the drug shortages for chemotherapy drugs, the pending SGR legislation, as well as the 2% reconciliation. The list goes on and on about the challenges and threats to providing cancer care in the community, and it's time that we engage the patients in our fight.
Tell us, what do you need from us and how can we get involved?
Well, please join us in our fight. If when you are a cancer patient, you have a cancer clinic. And there, in your cancer clinic, there are doctors and administrators, and what we're looking for is for you to take our message back to your cancer practice and say that there is a way to engage the patients in a professional relationship that does not need to have any negative components to it. We think that it's a strength to engage the patients.
Patients need to contact COA and the Patient Advocacy Network via what means?
An easy way is through the website at coaadvocacy.org for the patient advocacy component of it. You will find links and emails, contacts, and so I think that for the type of patient that we're trying to reach, the website is a good way to reach us. But you can find our phone numbers, call us, email us. We're happy to engage with every patient in this fight.
And for the patient whose physician is not yet a member of COA, what can you say?
Well, I like to think of this as almost a reverse osmosis, where instead of COA finding patients, we hope the patients will help the practices find COA. So we hope to work this issue both ways to enhance the participation by both the doctors and the patients.
There is a lot of repair work that needs to happen within healthcare and within oncology in particular, so the opportunity to create collaborative possibilities between patients and their doctors is pretty magnificent.
It's a new time for us, and we recognize that it's no longer enough to be a cancer doctor. Now we need to be a cancer advocate as well, to ensure that our patients get the drugs and that they're able to get their treatments in the clinics that are close to their homes. And these are terribly important issues to us, but we're not satisfied with the way things are now, and need to improve with the help of the patients.
Thank you so much, Dr. Rick Frame, Chair of the Community Oncology Alliance Patient Advocacy Network.
Thank you so much.